and welcome to the channel. If you just applied to internal medicine training in the UK, you've come to the right place. Today we're going to talk about what to expect after you've hit submit, how to prepare for the interview, and most importantly, how to have the best performance during the interview. So stay tuned, guys. If you're new to the channel, my name is Luca. I'm a cardiology registrar, currently out of program doing a PhD in the University of Oxford. Over the last 5 years, I've been working really hard to understand the application process to different specialty, primarily IMT, ACCS, and cardiology. The idea behind this was trying to get the best way to prepare you for you to be successful during your interviews. Today, let's walk you through what happens after you hit submit. Once you hit submit, and I know that felt very scary, now you have to wait for something called longlisting. Longlisting basically means they're going to see if you have the minimum requirement to apply for the specialty, and this happens across all specialties in the UK. Once they're happy with that, you're going to go through a process called shortlisting. Shortlisting basically means they have the capacity to have around 2.6k interviews in the whole country. What they usually do is they're going to take the top 2,600 candidates and they're going to shortlist them for interviews. Once that happens, you'll get an email saying you've been shortlisted and then now you've been invited for an interview. They don't set a cutoff point, just arbitrary. It's based on interview capacity. Once you've been successfully shortlisted, you'll be invited to book your interview. And this interview is going to be online, which already poses quite a few challenges, which means that you need to start thinking about where you're going to do this interview, because you don't want to be doing it in a place that is dark, that doesn't have good lighting, and that you're going to be continuously interrupted. You want a place where you're going to feel comfortable with good lighting and, very importantly, not being interrupted. If you get the interview, well done, you've gone through the big filtering process of IMT application. Now, up until this point, everything's relatively straightforward because it's all about your self-assessment and whether you meet the cutoff point or not. However, those marks that you got for your self-assessment now kind of disappear, and it's all about the interview. That means your interview is what defines you getting a job or not necessarily your self-assessment. The self-assessment sometimes can be used if there is a tie between two candidates, but otherwise it kind of disappears. Which means that during the interview, you're likely to talk about your CV and your achievements to date. It's kind of just laying everything on the table in terms of what you kind of score yourself in the self-assessment. Again, the interview usually lasts around 22 minutes and is divided in two big stations. They haven't done many changes to the interview format this year, apart from adding some communication score to station 1. What that means is that they're not just going to look at the communication during the clinical scenario, they're going to look at communication skills during the whole of the interview in a nutshell. Now, station 1 is going to be divided in two big sections. Section 1 is going to be your application and suitability for internal medicine training, and the second bit is going to be about an ethical scenario. Station 2, on the other hand, is going to be divided into three major sections. One of them is going to be when they give you the clinical scenario for you to read, which is going to last about 3 minutes, followed by around 10 minutes of clinical questions about how you approach the patient and so on and so forth, followed by 1 minute of handover. After that, the interview is done and they'll ask you to leave. Now let's talk about station 1. Let's talk about the first section, which is going to be your application, achievement, and suitability for internal medicine training. That's gonna last roughly about 7 minutes, of which 2 minutes are usually going to be spent you presenting yourself. 5 minutes follow-up questions, and then 5 minutes is going to be on the ethical scenario. The first section and the 2 minutes where you're going to present yourself are key, This is when you're going to grab their attention and you're going to either stand out or you're just going to be one of the bunch. During those 2 minutes, what you need to do is you need to outline 2 big things. One of them is going to be your clinical experience to date and how that links to a role in internal medicine. And second is going to be your academic achievements to date and how they might or might not link to internal medicine. Always focus on the ones that do. Now, this is one of the things you're going to have to rehearse very well. It doesn't need to sound scripted, but it needs to sound natural. And the best way to do is to practice to the point that it comes out naturally, but also make sure you do it in front of someone else, do it in front of the mirror, but in front of someone else so they can give you feedback. When you're doing your clinical bit, that means the first minute, talk about your experience to date and how those skills that you've gained during that clinical experience can be translated or transferable to internal medicine training. Then talk about your academic performance to date. That means all your research, all your QIPs, or your teaching training or experience in teaching, but also some leadership. Everything that makes you stand out as a very special candidate. One of the things I tend to advise people is always leave the best for last. That means open strong and close strong. Sometimes people will forget what you've said in the middle. So when you start in your 2 minutes, start with a very strong clinical experience that you're very proud of, and then end with something academically that you're very proud of. Whether this is a research project or a leadership thing you've done, something that leaves a mark. Then they'll ask you lots of questions about things in your CV, things that you've talked about, and they might ask you things around why you want to do internal medicine. And it's very important for you to be honest and say, internal medicine is a way for me to get foundation skills, for me to develop my career in neurology, in cardiology, whatever it is you want to do afterwards. Because rarely someone's going to say, I'm just going to do internal medicine. If that's you, that is okay. For most people, will always be aiming for a different kind of specialty, not just internal medicine. So it's very important for you to show how that links to that specialty. They might ask you questions around challenges you faced during the projects you presented or you just talked about. It's very important to always keep your answers short. What the project was about, what was your role, what was the outcome, and if they ask about challenges, how you overcame those challenges, and how those skills of overcoming those challenges can be linked to your internal medicine training. Once that's done, you'll move on to your ethical scenario. Usually they'll read out an ethical scenario for you. They'll ask you to walk them through how you would approach that ethical scenario. And if you think about the most common ethical challenges that we face in clinical practice, then you can start revising and reading the good medical practice from the GMC. Things like confidentiality, mental capacity, dealing with a complaint, medical errors, medical consent, and the list goes on and on. Sometimes things around your colleagues and them misbehaving, how you would approach that, how to escalate things, who to speak to, how to escalate concerns, and so on and so forth. Once that's done, you'll move on to the clinical scenario. Now remember, they're going to give you 3 minutes to read the scenario, so you're allowed to make notes, and by all means do. And there's 3 major things I always tell my students to do when they're preparing for an interview for internal medicine training. One of them is think about your differentials. Think about your management plan. That means what kind of therapies you can provide at your level, what senior colleagues you're going to involve in specialties. And 3, how you would hand over that patient, because those 3 are going to be key during the whole station. During the first 10 minutes, they're going to ask you questions around how you approach the patient, how we think about your A2E assessment, how to work with the team that's going to be within that clinical room. That means that if you're in A&E or in a ward, there's going to be nursing staff, although they're not going to be in the interview, but you need to think about how you can work as a team to get the patient sorted. And that's what they want to see. They want to see that you work with people, that you're a team player, but very important, you're safe. You're not going to come up with some fancy treatment that you know that requires a senior colleague to be present or to actually do the therapy. You want to show that you're a safe doctor, but you also know your stuff. That means that you think about potential lines of management, but always highlighting that this would be done by X, Y, Z specialty. Once the 10 minutes are gone, they'll ask you to hand over the patient. That means just go and do your handover. That means you're going to do your SBAR approach. That means situation, background assessment, and recommendation. Simple as that. Always show that you're thinking ahead, not just simple stuff like chase the bloods or these investigations. Recommend some potential therapies to say, well, I think this patient could benefit from X, Y, Z. Let's speak to that specialty. They might be able to help. And when revising for your clinical scenarios, think about the most common things you face in your acute medical take. If you start looking at things from, let's say, systems, you can come up with the most common conditions. If you think about the respiratory system, you think about asthma exacerbations, COPD exacerbations, pneumonia, pneumothorax, pulmonary embolism. If you think about the cardiovascular system, you can think about MIs, tachy and bradyarrhythmias, heart failure, valvulopathies. If you think about the gastrointestinal system, you can think about inflammatory bowel disease, you can think about upper and lower GI bleeds, although lower GI bleeds tend to be surgical, but how you would approach GI bleed in general. If you think about endocrine conditions, think about DKA, think about hyponatremia, think about Addison's crisis, and the list goes on and on. If you think about very unwell patients, think about septic shock, cardiogenic shock, anaphylactic shock, things that you would normally know how to manage. Think about your ALS approach. Even though you're all competing with each other, it doesn't necessarily mean that you can't work with each other to prepare. That means that you can go ahead, come up with a team and just prepare, just practice. Go through the ethical scenarios, bounce questions from each other to see what feedback you can get, what kind of answers you can get, and then come up with plans accordingly. Once the interview is done, they'll ask you to leave the interview or the call, and then you just gotta wait. Now, well done, you made it through, so it's time for you to just take a little break and just wait. Patience and time. And then what's going to happen is you're going to get something called a ranking. The ranking is basically going to be your position related to other applicants. That means you might be number 1 of the country, you might be number 2,000 of the country. Regardless of what it is, during that process while you're waiting for the ranking, usually what's going to happen is you're going to do something called preferencing, which is you ranking all the available posts in the country from the one you want the most to the one you don't want the most, the one you probably wouldn't want to take. And that is a process that's done on oral as well. After your preferencing and you knowing your ranking, it's all about waiting the job offered. Once you get the offer, you can either accept the offer with an upgrade, which means that if another offer becomes available that's better than the one you have based on your preferences, then you can get that. If not, you just can accept and then call it a day. You can also retain the offer, and that is usually for a very limited amount of time. It's usually about 24 to 48 hours. So it's just in case you are not really sure if you want to take it or not. Now, I hope the video was useful for you guys to understand roughly what the structure of the interview is and how you can prepare for the interview. If you want to take one of our mocks, you're more than welcome to book. You can have a personalized mock where you can have a full interview, we give you feedback and we tell you how to improve your approach to the interview. Everyone's different, and sometimes you just need someone to tell you how to improve the things you're already doing well, but the things you're not doing as well, there's always room for improvement. So if you like the video, please like, share and subscribe. And if you want to book a session to prepare you for the interview, you can see the link in the description. Stay tuned, guys.